Some months ago, I said that Australians would be tested like we have never been tested before, but we're a strong nation, and that we would meet those tests. And that will be true again now with the situation we're facing in Victoria. This is a global pandemic. There are no guarantees in a global pandemic. You have to deal with the situations that are in front of you. You need to deal with them consistent with your strategy and your plan, and you need to bring the country together to focus every resource on fixing the problem and ensuring that we can keep Australians safe and that we can protect lives and we can protect livelihoods. This is the challenge we still face. There has not been a day of complacency when it has come to dealing with this challenge, I can assure you, on behalf of the Australian Government. And through the National Cabinet, we have worked together to address all of these challenges, and that will continue. For the people in particular of Melbourne, this is hard. This is a hard call on you. It's tough, and it will test you and it'll strain. But you've done it once before, and you will be able to do it again because you've proven that. You've demonstrated your ability to deal with this. It's happening in Melbourne now. Of course, there's always the risk it could happen in other cities, and every step is being taken to seek to prevent that wherever possible. But we're all Melburnians now when it comes to the challenges we face. We're all Victorians now because we're all Australians, and that's where the challenge is right now. And so I want to thank all the premiers. Spoke to most of them yesterday, spoken to more of them today, for the great support they're giving to Victoria, whether it's in managing the very challenging issues now on the New South Wales-Victorian border, or the testing that is being done in Tasmania or in South Australia, indeed New South Wales and Queensland, the tracing work that is being done, drawing on the health professionals from Western Australia all the way to the East Coast. This is a national coordinated effort, and over the last several days, that has been where my focus has been, working with those premiers, working with the Chief Medical Officer, working with those on the ground as we are coordinating our response to support the efforts in Victoria. And so that's why there are 350 ADF people down there supporting the New South Wales effort on the border. That's why there are already around 200 ADF who are already supporting in the area of medical testing and other logistical support. That's why there is several hundred, in fact, the numbers of Commonwealth public servants up about 800, 900, supporting the door-to-door efforts. So it is a very significant Commonwealth effort to support what is happening in Victoria right now. And we will prevail, and we will get on top of it, and we will protect the rest of the country, because as I've engaged with other leaders around the world, they are facing the same challenges, whether in Europe or elsewhere. They are seeing, as they're opening up their economy again and fighting for the jobs of their own citizens, just as I am fighting for the jobs of our citizens, then they find there are outbreaks and there are cases. The one in Melbourne is particularly serious, but on an international scale, it is well within the band, and so it is not surprising, and that's why we need to continue to apply our focus and our effort and just work together as we did in March and in April and in May and in June, and so we will do it in July and August, September, October, November, December, and into next year if necessary. That is what we will do, and that's what we will continue to do. So I do reach out to those people, families, young kids, older residents, people working in essential occupations, and just reach out to them and say, the nation is with you, and we will be with you each and every day, because your success is our success. Our success depends on how well you're able to get through. And so whether it's the mental health support that needs to go in, whether it's the housing support that needs to be in place, these are the issues that over the last several days we have been dealing with to ensure that Victoria gets all the support they need. So with those remarks, I hope that addresses, as it should, the very significant issues we're now facing. And now I'd like to turn, if you indulge me, to the reason I've asked the Aged Care Minister to join me here today. And I think this is important because as we deal with the challenges of COVID-19 and the COVID-19 recession that has attended to that and has created these two great crises Australia now deals with, the work of government continues. The needs out across the country are just as present as they were before. And one of the most significant areas of need that we have been addressing as a government since the 2018-19 budget in particular has been the challenges of in-home aged care. Now, it was only last year after the receipt of the interim report of the Aged Care Royal Commission that we immediately responded to the immediate request that there'd be additional places provided for in-home aged care, and we immediately moved to put an additional 10,000 places. Today, I'm announcing with the Minister an additional 6,100 in-home aged care places, which will bring to an additional 50,000 places at a cost of some $3 billion that we have announced since the 18-19 budget. And every opportunity we have had as a government to increase the number of in-home aged care places since the 18-19 budget, the mid-year update that followed, the budget that followed that, the mid-year update that followed that, and now where we are here today, where we had hoped to have a budget obviously earlier this year, but that won't be till October. We believe that was necessary to make this announcement now, and we will take every opportunity in the future, including the budget and the mid-year statement that follows, to continue to address this task. This is about ensuring that Australians as they age have greater choices, that families have greater choices. We have many challenges in this country at the moment, but we will see our economy strengthen. We will see Australians kept safe, whether it's from COVID or the many other threats that this nation faces, and we will guarantee the essential services that Australians rely on, and this is a very good example of that, in meeting the needs of our elderly and the in-home aged care places that they need, and there'll be more. And we will do that in a responsible budget management, which the Treasurer and the Finance Minister and I and other members of the Cabinet will continue to apply the discipline to, so we can meet all of those challenges. But with that, I'll ask Richard to make a few comments about the specifics, and then I'm happy to take your questions.
Thanks, PM. So the additional 6,100 packages is evenly split between levels 1, 2 and 3 packages. The rollout will commence immediately and as the Prime Minister has said, that takes our investment in home care packages to 50,000 since the 18-19 budget at an investment of over $3 billion. And as the Prime Minister has said, it continues our commitment to providing choice for senior Australians in their age as they age, but also the opportunity for them to stay safe, be at home and age at home if that's their choice. We're also announcing today that the Royal Commission reporting date will be extended to the 26th of February, so that's a 3.5-month extension to the Royal Commission. The Commission, having had to close down for about 3 months due to COVID, had requested an extension, and we're announcing an extension to the 26th of February, and Commissioner Pagone will become the chair instead of the acting chair of the Commission as a part of the announcement that we're making today with respect to the extension of the Commission.
Thank you. Happy to take questions.
Prime Minister,
yep.
Our second most populous state is now shut off from the rest of the country. There are increased caseloads by the day. Is this more than just a localised outbreak that you've talked about, or are you confident that this is under control?
Well, there are 3 rings of containment, and the rings of containment has always been part of the government's national plan together with the states and territories. There are those suburbs specifically where we are seeking, I should say the Victorian government is seeking to ensure that containment measures are there. Then there is the broader Melbourne metropolitan area, including the Mitchell Shire. And then beyond that, there's the Victorian border. And as each of those rings does its job, it puts less pressure on the ring external to it. And I know that the New South Wales Premier, I spoke to her again this morning, is very focused on ensuring that there is appropriate protections around those border towns. And I saw the same cues as everyone else this morning. And as I flagged on Monday afternoon in a radio interview, there will be some disruption for a period of time as these arrangements are put in place. That's, I think, to be expected. And there will be some inconvenience, and that's regrettable, and we ask for people to show patience about that. I mean, the case numbers today was slightly less than they were yesterday, and we would hope to get better news on those case numbers. I mean, the level of testing has been significant, and we need to stay on top of that. But the isolation of those who are found to have had COVID is as important as it always has been. I'd be saying to those, particularly in New South Wales and those in the border towns, that particularly in the border towns, we're not seeking to see people move from there up to Sydney or places like that. I think for the time being it's wise and good common sense that if you live in and around those border towns, you'd stay close to those towns at present and not be going off to family events or other things more broadly across the state. The Premier has indicated similar sentiments this morning, and I'd support that. Similarly, people living elsewhere across New South Wales, now's not the time to make your way to close by the Victorian border. That's just not good common sense. And we'd ask people to exercise good judgment about those things. There's lots of family events and other gatherings that take place, and if people could exercise some judgment about their attendance at those, particularly around border towns, then I think that's the right thing to do.
Yeah. Given the breaches with hotel quarantine in Victoria, is there any case for slowing down the arrival of people into Australia at international airports? Is there a problem with the sheer load that's coming there? Should that be considered?
Well, the short answer to that is yes, and I'll be taking a proposal to that end to National Cabinet on Friday, and I've been discussing that with premiers over the last sort of 24 hours. I had a good discussion with Premier McGowan about the same thing yesterday. I mean, the fact is that New South Wales has been bearing the largest burden of people returning to Australia, and they're Queenslanders, they're Western Australians, they're Tasmanians, and New South Wales has done the heavy lifting on that and foot the bill for it too, I should say. And I thought that was one of the another good example of how the National Cabinet was working. No one was squabbling about money, about who was going to pick up the bill for quarantine. The large states, which were New South Wales and Victoria, accepted that and got on with it, and I commend them for that. Now, in Victoria, we've suspended those flights coming in, and that has meant that people have moved on to other flights going into other capitals, and we've looked at that, and as I said, I'll be taking a proposal to National Cabinet to slow that down as of this Friday.
You've previously been opposed to border closures, and you've said that the borders should reopen. So is it safe to say that you've now changed your position on that in light of the community transition in Victoria?
No,
and in relation to JobKeeper, there will obviously be a lot of anxiety now about when that runs out. Is it potentially an option to extend JobKeeper for longer by geography and just in Victoria?
No, look, 2 points. First of all, no, my position on borders hasn't changed. We need to understand what's happened here in Victoria. What we've effectively done is Victoria has self-isolated. So that creates a protection for all the other states and territories at the one time, and it doesn't leave it to the arbitrary decision of one premier or another premier. I mean, my view about people moving from New South Wales to Queensland or to South Australia or Western Australia has not changed. When you have a situation of an outbreak, you contain the outbreak. And that outbreak is presently in Melbourne. And to ensure we don't get further breaches of that, that outbreak is being contained now at the Victorian border. And that has always been the approach. Arbitrary decisions about state borders is a separate issue, and we'll continue to maintain our position that Australia is one country, and that response that is needed in relation to outbreaks, well, that will be put in place, and that will provide the appropriate protections, and that's what's being done. This is about Victoria isolating itself, not other states shutting itself off from Victoria, and there is a key difference in that.
If the situation there be a need
Oh,
to...
sorry, on JobKeeper on the other issue. Well, I've answered this question many times, and I've been consistent in saying that there will be a further phase of support that goes beyond September. So there's been, and there will be, and I've said that to the Victorian Premier, and as I said to Alan Joyce some weeks ago.